Hello everyone, I am Dr. Piyush Ranjan, gastroenterologist in Sir Ganga Ram Hospital, New Delhi. On the occasion of this World Digestive Health Day, I will discuss with you GI manifestations of COVID-19 infection. As we all know, COVID-19 is predominantly a pulmonary infection. However, it behaves like a systemic disease and involvement of GI tract is very common in these patients. In fact, one-third of patients with COVID-19 infection present initially with GI manifestations in form of nausea, vomiting, diarrhea and pain abdomen. In patients with severe COVID-19 infection, nearly 75% of patients have some form of GI manifestation. Raised transaminases or liver enzymes is the most common manifestation. It is self-limiting in most of the cases. However, the use of other drugs, especially remdesivir, becomes very important in the setting of deranged liver functions. The other common manifestations in GI tract include small bowel and large bowel ileus, acute cholecystitis, acute pancreatitis, and a small minority of patients may have intestinal ischemia. The pathogenesis of GI involvement in patients with COVID-19 infection is due to the ACE2 inhibitor receptor present in GI epithelium, in gallbladder epithelium and in pancreatic ductal epithelium, and in addition thrombotic microangiopathy also plays a role in this. As gastroenterologists, we all must be aware of the spectrum of GI involvement in COVID-19, their outcome and their management, so that we can give the best to these patients who are already very critically ill and lead to an improved outcome of these patients. Thank you so much.